Myers Counseling Group podcast. We offer mental health, substance abuse, and wellness information for the community. To find out more information and to access previous podcasts and other resources, visit us at myerscounseling.com. Hello, I'd like to welcome today's guest, Dr. Jay Stone. Dr. Stone is a clinical hypnotherapist who practices in Northern Illinois and Chicagoland area. He's also an author and a presenter as well. Welcome, Jay.
Hi, Mark. It's an honor and a privilege to be your guest today.
Thank you. Jay, can you tell us something about yourself, a little bit about your practice, what you do?
Well, my first patient was myself. In December 1982, I finished my last undergraduate class. It was 9 o'clock in the morning, and I wanted to drink a few beers to celebrate, but by the time I graduated college, I learned two important lessons the hard way. Don't drink in the morning, don't drink too much. So I came home, my roommate had a book on self-hypnosis. I read the book cover to cover and did all the exercises and went in and out of a trance a dozen times that day. And I says, wow, hypnosis feels great. It's very relaxing. Does it have practical value? At the time, I was 25 years old, and I've been biting my nails for 20 years. And so I decided to hypnotize myself to stop biting my nails, and it worked. And so since that fateful day in 1982, I've done self-hypnosis at least once a day, most days twice, and occasionally 3 times a day. So I practice what I preach.
Now, Jay, I'm sure we could cover this, at length here, but just briefly for people, if you could tell us a little bit, what exactly is hypnosis?
Well, hypnosis comes from 2 Latin words, means condition of sleep. But early on, the medical doctors realized that hypnosis, calling hypnosis a sleep state is not exactly true. Most hypnotists define hypnosis as an extreme state of focus and concentration. So if somebody was trying to lose weight, they would use that extreme focus and concentration to lose weight. Or if they were trying to recover from cancer or manage their anxiety, they would use their extreme focus and concentration for that. But I also define hypnosis as relaxed wakefulness. The body is relaxed. There's a decrease in heart rate and blood pressure and muscle tension. Respiratory rate decreases. Oxygen consumption decreases because that's what the body does when it's relaxed, and there's more blood flowing to the brain. So the body is very relaxed, yet the mind is in a rapt state of attention or highly focused and concentrated.
Are people conscious when they're being hypnotized? Are they aware?
Well, they can. There's different stages or levels of hypnosis. There's scales from 1 to 3, like light, medium, and deep trance. There's scales 1 to 5 or 1 to 20. But studies have shown that the depth of hypnosis doesn't matter. So getting back to your question, people may drift in and out of consciousness. For example, they might remember for a 20-minute trance, they might remember 2 or 3 minutes of the 20 minutes, or they might have complete amnesia where they just open their eyes and say, okay, well, let's start the hypnosis.
Do people need to be induced by a hypnotherapist? Is that the only way to reach a hypnotic state?
Good question, and no. As in my case, I do self-hypnosis, so I am the person giving myself the suggestions to relax, and we actually pass into a trance state about 16 times a day, every hour and a half, plus or minus 30 minutes. So every hour to 2, we're meant to take a rest break, or every hour to 2, we're going to go into a trance anyway. And so in my opinion, it's not a question of whether we're going to do hypnosis or not. It's a question of whether our hypnosis is going to help or harm us.
What would be an example of harming us?
Well, I would define that as negative self-hypnosis or negative goal setting. For example, somebody gets on a scale and they say, "Oh my God, I've never weighed so much," and then they imagine themselves getting fatter or heavier, and as a result, they set a negative goal for themselves and they work towards it.
Hmm. What does a person look for in seeking out a hypnotherapist?
Well, I think someone who's actually practicing self hypnosis on a daily basis, because studies show that the hypnotherapist goes into a trance before the client does. But you would want to pre-interview anybody that you were going to see, so you must feel comfortable with the person. The person must be articulate. After all, it's mainly the voice that the person is going to listen to go into a trance. Creativity, honesty, ethical, um, somebody who is has a good imagination, who's actually informative and entertaining.
Hmm. Is there a certification board for hypnotherapists or licensure?
Well, there are. There's several. There's several. There's several. I'm affiliated with the American Board of Hypnotherapy on the West Coast. There's the American Guild of Hypnosis, and so that gives them a certification, which enables a hypnotist to get insurance. So my insurance comes from the same company that insures psychiatrists, psychologists, social workers, and pastoral counselors.
Are there different styles of hypnotherapy?
There are. Probably the most famous is Ericksonian hypnosis, which comes from the work of Dr. Milton Erickson. Then there's neuro-linguistics programming, NLP, which comes from several PhD social workers that observed Erickson's work. There's timeline therapy, and then plus there's very different techniques. There's age regression, where we might regress somebody into the past to find out what the problem is, or do an age progression. Let's say with someone with cancer, to know what they expect in 3 months or 6 months or 9 months, because what we expect and imagine for our future is very important, because generally that's what we work towards.
You've touched on it several times, but if you could explain to me, what would someone seek out a hypnotherapist for? What could it be used for?
Well, the number one mental health complaint that people go see a doctor, psychologist, social worker for is anxiety. And hypnosis is ideally suited for anxiety, because the when somebody's in a trance state or relaxed state, it's totally contradictory to someone who's feeling anxious or stressed. Stress management, um, hypnosis is effective for depression, addictions, um, uh, you name it, the gambit, and also physical problems, such as backaches. That's like the number one reason people miss work, because when people are relaxed, there's fluid that flows through the spine. It's called the cranial sacral fluid. And in my personal experience, my professional experience, um, hypnosis helps to alleviate backaches. Actually, there is some medical research that shows that.
Hmm.
Cancer, there's 22 studies that shows visualization helps fight cancer. Any of the autoimmune diseases, allergies, asthma, etc.
End of part one. How about sports? Is that something other types of self improvement? Is that something someone could use
Oh,
hypnosis for?
good point. And people don't necessarily have to have a problem. Um, Sports, many of the professional athletes do it: golfers, tennis players, Olympic divers, skaters, gymnasts. At the last Olympics in Beijing, several times on TV, they would be focusing on a gymnast, and the gymnast would have a headphone on, and the body was moving, and the announcer would say, "Oh, they're visualizing their routine." So what happens is if a professional athlete uses hypnosis or visualization, it allows the athlete to practice their Olympic sport without actually physically doing it. And just by practicing something in our imagination, it enables us to improve at whatever we're imagining. So also, I think it's important for your listeners to know that hypnosis has a tremendous practical value as a form of preventative medicine. Every day we wash our hair, we brush our teeth, we clean our bodies, but internally our bodies get sullied or stressed or tense, and so we have to have some form of means for an internal cleansing to make our insides as in optimal health as we do the outsides.
If you could walk me through a typical session, what may be involved in that?
Well, actually, the hypnotherapy, as I assume in social work and psychology, that your appointment really begins before the session. So usually people will call and ask me questions, and I've helped people over the phone without them ever coming. I recall a young woman crying. She was at an L stop in Chicago, and her boyfriend was beating her. And I said, you don't deserve it. You don't have to be in a relationship. 2 years later, she called me and thanked me that she was in a new relationship that was heading towards an engagement and marriage, and she remembered that conversation that we had. So really a good hypnotherapy session will begin when the potential client or patient interviews the hypnotherapist. Patient walks in, I already have an idea of what's going on, so the first question I'll say is, why are you here and how can I help you? And then it'll just go on from there. I'd also like to add that I always videotape my sessions, and my clients get a copy, a DVD of their entire session. And I find it really helpful, and I started that when a medical student was sitting in on my sessions, and he said to me, nobody will believe this. And at the time it was like a 12 or 13-year-old boy who was a bedwetter, and he said, you should record it. And so I did. And so I find it helps to put my clients at ease. But part of our brain learns from life experiences. So a hypnotherapy session doesn't end once the client walks out the door. When they go home and they review the session, it's an opportunity to learn, understand, or become aware of something that didn't occur to them while they were in their appointment. And so days, weeks, years after an appointment, if a patient is still reflecting upon their session, they will benefit from it.
It doesn't sound like there's any specific structure that you would be able to. It really depends on the person and the client and the presenting problem.
Well, it's client-centered therapy.
Excellent.
What I'm doing, I do take history like a therapist, like a traditional therapist. And while I'm doing while I'm taking the history, I'm doing therapy with the patient. Sometimes it can involve if the patient is visual, I'll have them draw out. So if people go to my website, www.drjaystone.com, drjaystone.com, they could actually see some of the drawings that my patient's done. But I'm building up towards doing hypnosis, usually at the end of the session, and I record a CD, which my clients take home and they can listen to over and over again. For somebody said to me, "Are you Jay Stone?" I said, "Yes." And the guy says, "I want to meet the guy that's been sleeping with my wife." I said, "What?" I said, "I want to meet the guy sleeping with my wife." And I'm really getting nervous. And he starts laughing and he extends his hand. He says, "I listen to your hypnosis programs every night before going to bed." Um, so, I definitely, use, technology, making clients, customize recordings. And also a valuable technique is age regression, where I might regress a person to when the problem started, and often it's a lot earlier time. Uh,
How long do sessions actually last?
well, I like doing a longer session. I do a 2-hour session. Most therapists do a 1-hour session, but sometimes I feel a 2-hour session is even too short. And the reason being, for the longer session has to do with the cycles. It's called ultradian cycles. Um, that's uh, that's why I mentioned that we go into a trance every hour and a half, plus or minus 30 minutes. So I'd rather have clients come to fewer sessions but longer sessions, and especially if clients are very busy, and a lot of my clients travel to meet me. They travel quite a distance, and so the longer sessions are beneficial.
How long does a person, not the sessions, how long do they last, but length of time a client may participate in hypnotherapy?
It all depends, but usually hypnotherapy is classified as brief therapy. So if somebody's coming for anxiety, I would say maybe 2 to 4 sessions. I recently had a young woman with anorexia and bulimia, and she hospitalized twice and went through outpatient therapy, and she made no progress. She came to me, and I would say we did 8 or 9 sessions. I'd say 8 sessions maybe, and she felt she was cured, and her parents would weigh her on a daily basis, and that had stopped. Um, and so I think psychiatrist Daniel Amen said it best. He said, "Skills, not pills." And even though he's a psychiatrist who can prescribe medicine, he firmly believes in teaching his patients skills. And I'm the same way. So if someone comes to me, they're going to learn many skills that will enable them to do their own therapy or to engage their own personal growth or healing process.
Great. Now, you refer on your web page of a timeline therapy, but please explain what that is.
Well, timeline therapy was developed by Tad James, and it's an age regression technique, and it's called content free. So let's say somebody was angry, and by the way, as a therapist, I'm sure you'll appreciate this, or your listeners will appreciate this. Anytime someone's angry, according to Virginia Satir, there's a demand. When someone is angry, they're demanding that something be different. And so, let's say someone's coming to me, they have anger issues with their spouse. They can't control their rage. And so we would take them, well, when was the last time you were angry? And then we go back and back and back. And then the person learns a life lesson, and they connect it to a feeling or sensation in their body, because people
Are there people who cannot be hypnotized?
No, everybody, by design, our maker designed us to go into trances. Um, so, but you have to use the right technique. Children are, by the way, are the easiest to hypnotize because they have so imaginative and creative, and they just go into trances quite easily. But no, everybody can be hypnotized provided it's the right technique. I've even hypnotized people at age 84, 87.
Hmm.
And by the way, the ability to go into trance decreases with age. And I believe if we practice self-hypnosis or meditation or pray or visualize, we maintain our ability to go into a trance, and so we age more slowly or we age more gracefully. And this plays into the aspect of hypnosis as good preventative medicine.
Is it possible to work on more than one goal at a time?
Yeah. There's in neurolinguistics programming, there's referred to as meta programming. So, let's say just being more of a positive thinker. So, if a person has a goal to lose weight, think positive about losing weight. If a person has a goal of earning more money, thinking positive about increasing the income. If a person has a goal to be a better spouse, then the person thinks positive about their spouse and relationship. So, yeah, it's quite possible to work on more than one goal, but I believe it has to come from that meta level, which means to go beyond.
Jay, I know we've covered an awful lot, and I'm sure there's an awful lot more to go on this. If you could let me tell us if there's something that we may not have covered, any points that you think would be helpful for the audience to know about, get a better idea about hypnosis?
Well, I would say to your audience, the best thing you can do is honor your rest cycle. Every day we go through what's called the BRAC, Basic Rest Activity Cycle. And this is, and our energy levels fluctuate up and down throughout the day. And we have more energy hormones, we have more energy, we have less energy hormones, we have less energy. And so when your energy is at its lowest, take a rest break. Close your eyes, do some deep breathing, listen to classical music or nature sounds, and just honor your rest cycle, and your life will improve from within. You'll naturally increase your focus and concentration, your creativity, your intuition, your memory, and you'll be more peaceful inside, more calm and relaxed. And in today's society, we really need inner peace.
Thank you very much, Jay. Now, how can people contact you?
Well, they can visit my website at www.drjayspone.com. My phone number is listed there. Best number to reach me is at 773-665-4623.
Great. Jay, thank you very much for your time, and we appreciate it. And again, thank you for coming on our show.
Mark, it's been a pleasure. You are someone I admire and respect. You're a good man.
Thanks, Jay. Hello. Welcome to Myers